So this is the only video that you need to understand scapula's osteology. So let's begin. So the other name for this bone is shoulder blade, and it is a type of flat bone, as we can definitely see. Now let me talk about very important landmarks on the bone. So this process is called the spinous process of the scapula. This cavity is called the glenoid cavity. This is the supraglenoid tubercle. Below it is the infraglenoid tubercle. We can see a notch which is present here. This is called the suprascapular notch. This is the coracoid process, which is actually shaped like the beak of a crow, thereby its name. And this is the acromion process. And this is the costal surface, and you can see clearly that there are markings for ribs. So now let's come to the side determination of the scapula. So this is the spinous process which lies posteriorly. This is the costal surface which lies anteriorly. This is the glenoid cavity which lies laterally. Therefore, we can say that this is the left scapula. One more thing to note is that scapula lies more laterally than posteriorly. Okay. So it lies at an angle of 45 degrees with the coronal plane. So this is the coronal plane and it lies 45 degrees to the coronal plane. Okay. This glenoid cavity articulates with the head of the humerus, and the acromion process articulates with the lateral part of the clavicle. So this is how the three bone system of the upper limb is articulated. And a shortcut trick to hold the scapula in its anatomical position is to hold it as if you're holding a gun, which ensures its correct position. Now let's talk about the main muscle attachments of the bone. So in the ventral surface, in the medial border, we know that we'll get the attachment of serratus anterior. So serratus anterior is such a muscle which actually winds around the ribs. So consider my fingers to be serratus anterior. So this will be the direction and then ends in the medial border of the scapula. And then we find the attachment of subscapularis muscle here. In the posterior surface, this is the spine. Therefore, supraspinatus muscle will definitely be above the spine here. Infraspinatus will be below the spine. You need to remember that three muscles are on the medial border and three muscles are on the lateral border. In the lateral border, we find teres minor, teres major, and latissimus dorsi. Bear in mind that teres minor's attachment spans greater than that of teres major, which is relatively smaller. And in the medial border, we find the attachment of levator scapulae. You can remember it in such a way that anything that elevates a thing should be placed somewhat above. So levator scapulae here, we have rhomboideus minor and rhomboideus major. So the attachment of the acromion process is also highly important. So this denotes the attachment of the muscle trapezius, and this denotes the attachment of the muscle deltoid. Now let us come to the attachment of coracoid process. We have three ligaments and three muscles: short head of biceps, coracobrachialis and pectoralis minor muscle, along with coracoacromial, coracohumeral and coracoglenoid ligaments. This is the serratus anterior muscle used for movements like protraction and punching as needed in boxing. This is supplied by the long thoracic nerve, also known as the boxer's nerve, and injury to it causes swinging of scapula.